marking grid, so I sterilize the skin surface, and then afterwards I put this grid on, and you have to wet it down because it has the marking dots on there, and that's actually my roadmap of how I'm going to do the treatment. So then what I'll do is I'll just peel this off very slowly, and voila, you see my map where I'm going to do the treatments. And you know, I'll have her sit up in a minute and I'll actually fine tune exactly where I'm going to put the injections. But Kybella works great in the under chin area to help dissolve fat, helps tighten skin, helps retract muscle. And I'll give a little bit of an anesthetic injection because you do get some burning, and the patients do great with it. Usually 3 to 4 treatments scheduled about 4 to 6 weeks apart, and then you get a significant reduction. It's a great non-surgical option to help the under chin fat, the fullness that people have, the double chin. So thanks for tuning in. So here I am. Now I have her sit up, my very nice patient here, and I could just kind of really target which dots I want to treat, because obviously there's no fat up here in the chin area, and it's a big grid. So Kybella, in like all my treatments essentially, it's a very targeted treatment. So you want to make sure you exactly target everything. So it's just not, okay, put the grid on, inject the spots. You really have to see where the fat pockets are, right? And it's mostly under here. So, and you got to be very careful also, because there's a lot of critical nerves that run in the area, especially in this area here. It's called the marginal mandibular nerve. If Kybella affects that, you can get a little bit of mouth droop, and that can last 2 to 4 weeks, sometimes 6 weeks. So you really want to be very well qualified, have a great experience as an injector, as an expert injector, in order to deliver the proper treatments and the best treatments for your patients with the most minimal or no side effects for the treatments. And that's exactly what I do for my patients. So thanks for tuning in. We'll start the injection soon. You're gonna feel, okay. All right, so here we are. Now we're gonna inject a little bit of, we're doing the Kybella treatment. This is a little bit of anesthetic. Okay, a little pinch and burning. So by doing this, she'll feel about 80% less of the actual treatment. So I just kind of spread this anesthetic around for her. And obviously you want to know the anatomy very well when it comes to this. There's not a lot of injectors that actually numb up their patients for Kybella, but I offer it for my patient's comfort. So this is a little bit of lidocaine. Obviously a lot of critical structures in the neck. You have to know exactly what you're doing. You got your carotid artery, your jugular vein, you got your marginal mandibular nerve. Ton of very important anatomic structures that you want to make sure that you don't make them angry or affect them at all, because they help you breathe and talk and swallow and all those great things. So a little pinch over here. So it's a very targeted type treatment. Like I said, this will take the edge off. It doesn't numb up everything completely, but for those patients that are a little more sensitive, I love giving a little bit of anesthetic for the treatment. Okay, so here we are. Now that the numbing works instantaneously, so we're just gonna start doing the Kybella treatment now. So it's a 30 gauge needle, and it's 1/2 inch, and I just go right in my markings here. I really target the central area really well, because that's the area that you have the most fat accumulation and the most hanging of the skin, etc. So, and I'll vary the amount of Kybella that I'm doing in each area. Like as I get to the outer edge, like here, it's like I'll probably do like 1.5 or so. But when I get kind of like to the mid area where the fat is really excessive, or more of a pocket of fat, then I'll do a little bit more in that particular area. And always keeping in mind where I am in my grid. So I did the black one, I'm on the red, and then I'll move on accordingly. So it's really important that you keep an idea of where you are anatomically, and that's really important to have that aspect whenever you're doing these type of treatments. So a very slow, deliberate treatment. I don't rush during this. I really want to target the fat really well. So again, I typically recommend 3 to 4 treatments of this, and they're scheduled approximately 6 weeks apart. You will get swelling after this treatment, but patients usually tolerate the swelling pretty well. And you start to notice the result probably after the second or third treatment. So I just want to give you an idea. I injected this area. The rest is pretty repetitive what I'm doing. But it's a great treatment, great non-surgical treatment to help reduce the under chin fat, the double chin that patients dislike. And very comfortable treatment when you give some anesthetic, and patients do great with it. So thanks for tuning in.